physician. Welcome, Krystal, and thank you for taking time out of your busy schedule to chat with us today.
Thank you for having me. It's a pleasure. And I'm sorry we're not doing this in person, but it's great to see your faces.
It is good to see you, and hopefully we'll be able to have lunch again someday. That's so fun.
I know. Soon, right? Soon.
Well, our endowment partnership, our friendship with LSU UMC began in 2016. And we saw a glaring need to provide financial assistance for people who wanted 3D screenings as the best possible diagnostic for breast cancer. And it's not just for women, it's a concern for men as well. And some folks were not able to come up with the additional costs for service.
Yeah, it's really been, an amazing tool for our physicians, clinicians to be able to not turn women away based on insurance issues. Having these funds means that even if we run into a snag with an insurance provider, or maybe they don't have the full coverage, as you were talking about, these funds can step in and fill a gap. And what's interesting is early on in my career here with LSU Health, I met with a cancer patient at UMC. Actually, it was around early 2016 or late fall 2015, and she was explaining to me that she works a full-time job and all these things, but the insurance that she had nowhere near covered the services that she needed for dealing with breast cancer. And it was heart-wrenching for me to hear that story and meet her and know how hard she's working, and the job that she has was a legitimate job. I mean, it's a job that anybody would have. You're working that hard, you're paying for insurance coverage, but the coverage just doesn't meet the needs for what you have to go through with breast cancer. So that was shocking to see that's out there.
You're absolutely correct. That was a glaring, shocking reality. And thankfully, Medicare and Medicaid were the very first ones on board to cover the better screening. And it took a while for the other insurance companies to get on board. We never want patients to try to make a decision, am I going to buy groceries this week, or am I going to have a life-saving test to mitigate what's coming down the road for me? That should never, ever be a dilemma for anyone.
Absolutely. So this endowment has really helped in that area where we're not having to have these patients make those kinds of decisions. This endowment helps relieve that for them when that presents itself. So it's invaluable. It's life-saving. It's peace of mind. It's all of those things as you're going through a really traumatic diagnosis and then figuring out how you're going to deal with all of it. So
and that's really paramount to us to eliminate those anxieties,
yes,
so that a patient can concentrate on getting well, no matter what it takes for them to get well. And everyone gets well differently.
Right.
Now that 3D in Louisiana is a standard screening mandated by House Bill 460 in June of 2018 for breast cancer patients, what suggestions do you have regarding how KTSRBI can provide help beyond diagnosis? In other words, integrative medicine is a new tagline that it's not instead of chemo or radiation, it's in complement to. Some people may get better with some mental health assistance. Others may get better through massage therapy or acupuncture therapies. How do you see our partnership and UMC or LSU work those possibilities into a cancer patient's health journey?
Yeah, I mean, we're excited for that journey with our partnership, is to create that comprehensive care with UMC and maybe potential other partner hospitals that are working with us on our cancer treatments. And as you mentioned, things that go into your mental health as you're dealing with breast cancer goes far beyond just the chemo and the treatment. And so we're really excited to work with you and bring a comprehensive program to our patients that delivers more than just the technical treatments of, chemo and that kind of thing.
That makes me so excited to see what's coming down the pike for sure. Well,
Yes.
Tell us a little bit about how you've been handling your quarantine and this crazy crisis that we're in and the new norm moving forward.
Oh man, the new norm moving forward is still, I feel like, yet to be seen. I think none of us really knows. I'm a huge football fan, basketball fan. I hold season tickets to the Pelicans, which that season still hasn't even been officially canceled yet. So I don't even really know what our new norm looks like. I have no idea. But for us right now, in the short term, one of the things that I've learned in my career in philanthropy is, people are philanthropic. And during these times, philanthropy usually does still rise to the top, because at the end of the day, you still need healthcare, you still need education, you still need all the things that make us America and who we are, and we need to be innovative. We need to be thinking outside the box and bringing those big solutions to these problems that are devastating, and you need money to make it happen. And so for us, it looks different. I can't have lunch with you. We can't have this visit, face to face. I can't give you a big hug and tell you how important you are. But we're making time through Zoom conferencing. We're trying to host webinars ourselves, much like this podcast that you're doing, to bring the healthcare experts out front and center to you and other donors that have been so generous and philanthropic with your dollars and putting them in a place that you feel is making an impact on the healthcare community. And I really do think LSU is making a tremendous impact and doing everything we can to put that message out there and then just continue that resiliency, because it is difficult I think, to be in this kind of world and environment. And, especially for philanthropy, that job is out front and center, handshaking, events, that kind of thing. And this looks very different. It's very isolated. So
It is. It's very strange. Thank you for those kind words. And we look forward to a continued wonderful relationship with LSU, and our followers need to continue to demand 3D. Krystal, thank you so much for joining us today, and I hope to hug you soon.
Yes, it's coming. A big one.
Thank you,
Krystal.
Krystal. Happy birthday.
Oh, thank you.
Happy birthday.
Thank you very much. I had a great 40th, and 40 is the new 30, right? And 60 is the new 40. That's sort of how I feel. So,
I'll be 60 this year, and I'm embracing it because
you do not look it.
Yes. Oh, well, thank you. Being on this side of the grass, it's pretty good.
It's pretty good. I'm looking forward to that. I know. That's why I wrote, and I'm ready for another 40. And then hopefully when that increment comes, who knows? Maybe I'll be ready for another 30. We're living longer,
That's right. Embrace it.
That's the plan.
It is the plan.
Well, you make 40 look fabulous.
Well, you make 60 look very desirable. I'm excited for it.
See, I'm thinking about telling people that I'm 70, and then they'll go, wow. And then I'll say I'm 60.
No, you say you're 60 and it's still wow.
Well, thank you.
Generation go, okay, that's not so bad. That looks pretty good. That's very doable. Yeah, let's do it.
Well, thanks, honey. Go get ready for your next meeting.
All right. Well, and thank you for all your support. We're excited.
Love you guys.
We've got a lot of great things coming down, and we're excited for all of them.
Very exciting.
Together and pulling it together. So thank you again.
Thanks, Tony. See you soon.
Thanks, Chris.